The final topic video for Unit 8 covers two topics, 8.14 and 8.15, pollution and human health, and pathogens and infectious diseases. Even with the amazing advancements in medical science and technology in the last century, humans still face a wide range of potential diseases. The number of health risks that we face in our lives can sometimes feel overwhelming, seeming like we hear new warnings about them every day. A disease is any impaired function of the body with a typical set of symptoms. Those that are infectious are caused by pathogenic agents, such as bacteria or viruses. All diseases can be categorized as either acute or chronic. Those that are acute cause impairment more quickly than those that are chronic, which typically develop over a much longer period of time. Historically, disease-causing pathogens have taken a large toll on human health and mortality. Communicable disease has existed since humankind's hunter-gatherer days, but the lifestyle shift that occurred with the agricultural revolution created communities that made epidemics more possible. Some of the earliest recorded diseases that appeared during this time period include malaria, influenza, tuberculosis, and smallpox. The larger these communities became, growing from towns to cities, and creating trade routes to connect with other settlements, and waging war with them, the more likely the spread of pathogens became. Numerous factors can cause people to be at risk for both acute and chronic diseases, and the presence of pollutants in the environment complicate the evaluation of that risk. Although air and water pollutants themselves don't directly cause disease, they may contribute to conditions that are more conducive to disease transmission. A number of human behaviors and conditions, some willingly engaged in and others not, include obesity and the use of tobacco and alcohol, and malnourishment. For these reasons, connecting a particular pollutant to a specific disease is challenging, but there are a few well-known examples. Sewage and wastewater contain bacteria, parasites, and viruses that can cause infections of the intestines, lungs, and other regions of the body. It is well known that asbestos fibers are the causal factor in a specific kind of cancer called mesothelioma. Additionally, breathing in asbestos fibers increases your risk of developing asbestosis and lung cancer, as well as cancers of the digestive system. Tropospheric ozone can cause damage to the lungs. Relatively low amounts can cause chest pain, shortness of breath, and throat irritation and coughing. Ozone can also make chronic respiratory ailments worse, such as asthma, and weaken the body's ability to fight respiratory infections. Two primary factors are responsible for the increase in the spread of infectious diseases. The first is the increasing density of human populations, and the second is the ease with which people can travel between populations. The more close contacts individuals have with one another increases the probability of the transmission of an infectious agent between them. The more travel people engage in, the more likely an infectious agent is to be introduced to new populations. This provides pathogens with a greater number of new hosts to infect. Some pathogens, regardless of sanitation practices or the availability of medical care, are found everywhere, in developed and developing nations alike. Examples of pathogens like these include hepatitis, influenza, rhinoviruses, which cause the common cold, and some kinds of bacteria like E. coli and Salmonella. However, other diseases are limited to a particular geographic range, such as the tropics, or only pose a problem when sanitary conditions are lacking, especially when clean drinking water is limited. Diseases that are carried by vectors, such as mosquitoes, fleas, other insects and rodents, are generally limited to the geographic range of the vector itself. In other words, if a virus is carried by a particular insect, and that insect can only live in one part of the world, that virus is also limited to that part of the world. But, thanks in large part to climate change, the potential geographic ranges of many diseases are changing. With a warmer Earth, one that has changing weather and precipitation patterns, where certain pathogens can be found is also changing, generally increasing the range of them. Valley fever is a fungal disease that infects mammals and is largely limited to northern Mexico and the southwest of the United States. Warmer temperatures are predicted to expand the range of the fungus over the next few decades, opening up a larger area of habitat that the fungus can survive in. There are many examples of pathogens found in the tropics and subtropics. The diseases caused by them are generally less prevalent in temperate climates, due mainly to the occurrence of colder seasons, which control the insect population that act as vectors for them. Diseases like West Nile virus and malaria are modeled to demonstrate larger geographic ranges in the future on a warmer planet. What follows now is a collection of specific pathogens and the diseases they cause, along with some of their characteristic features. Bubonic plague, sometimes just referred to as plague, is caused by a bacterium called Yersinia pestis, for which fleas act as a vector. Within just a few days of exposure to the bacteria, symptoms develop, the most characteristic of which are swollen lymph nodes known as buboes. Although treatment with antibiotics is possible, without treatment, up to 90% of those infected die within 10 days. The plague is considered to be the cause of the Black Death that swept through Asia, Europe, and northern Africa in the middle of the 1300s, killing an estimated 50 million people, which included up to 60% of the European population. Because so many working-aged people were killed, the demand for labor caused wages to rise, and some historians recognize this as an important pivot point in the economic development of Europe. The World Health Organization reports between 1,000 and 3,000 cases of plague every year, with up to 15 in the United States. Tuberculosis is caused by a bacterial infection and generally affects the lungs. Many people that carry tuberculosis show no symptoms, but around 10% of infections progress to the active disease, killing about half of those infected. As of 2018, nearly 2 billion people, or 1/4 of Earth's population, is thought to carry tuberculosis. TB is an important example of a historic disease, as it has been present in humans since ancient times. As a matter of fact, scientists estimate that TB has been responsible for the death of more people than any other infectious disease in history. In just the last 200 years, over 1 billion people were killed by tuberculosis. Malaria is an infectious disease for which mosquitoes are vectors that affect humans and some other animals. Caused by a parasite that mosquitoes carry, symptoms of infection usually begin a week and a half to 2 weeks after being bitten by a vector mosquito. The disease is widespread in the tropical and subtropical regions around the equator. In 2020 alone, there were nearly 250 million cases of malaria globally, resulting in over 600,000 deaths. The risk of contracting the disease can be reduced primarily through prevention methods, like mosquito nets and insect repellents, as well as the use of insecticides and draining any standing water that mosquitoes would use as a breeding ground. West Nile virus is most commonly carried by mosquitoes, which can infect a large number of bird species as well as about 30 mammals, including humans. Since there is no vaccine or specific treatment for West Nile virus, the best approach is to reduce the risk of infection by avoiding mosquito bites. Although the mortality rate for this tropical disease is relatively low, greater numbers of infections are projected because of increased spread of the virus's vector due to climate change. Additionally, higher temperatures can affect the rate at which the virus replicates, speeding up its evolution and increasing the efficiency with which the virus can be transmitted. Severe acute respiratory syndrome, or SARS, is a viral respiratory disease from the coronavirus family. The first known occurrence of SARS was in China in late 2002. Since no specific treatment exists, infected people are supported with fever-reducing medication and mechanical ventilation if necessary. SARS was relatively rare, infecting only about 8,000 people, but had a nearly 11% mortality rate. Thankfully, no cases of this coronavirus have been reported since 2004. A very closely related disease, MERS, Middle East Respiratory Syndrome, is also caused by a coronavirus. As with nearly all coronaviruses, symptoms include fever, shortness of breath, and cough. The first case of this disease was in mid-2012 in Saudi Arabia. Most of the approximately 2,000 cases have occurred on the Arabian Peninsula. Like SARS, there is no specific treatment beyond the support of the patients during the infection. But unlike SARS, MERS had a mortality rate of about 35%. There is limited evidence of the sustained spread of MERS from person to person, and although it is still unclear, it is believed that the virus is transmitted from camels to humans. Zika fever, or simply Zika, is caused by the Zika virus. Mainly spread through mosquito bites, it can also be sexually transmitted and by blood transfusions. Symptoms of infection include headache, fever, and rash. Pregnant infected women can also spread the virus to their fetus. The most noticeable complication arising from this is microcephaly, having a smaller than normal skull. Known since 1947, the most well-publicized outbreak began in Brazil in 2015, spreading to the rest of the Americas, Asia, and Africa. Although the World Health Organization's public health emergency on Zika was lifted in late 2016, this virus is an illustrative example of one whose range will increase with climate change. Cholera is an infection of the intestine by a bacterium. Vomiting and muscle cramps may occur with infection, but the classic symptom is large amounts of watery diarrhea. So severe that it can lead to severe dehydration within hours, resulting in cold skin, sunken eyes, and wrinkling of the hands and feet. Affecting up to 5 million people worldwide, cholera results in the death of well over 100,000 people annually. The best defenses against cholera include preventative ones like improved sanitation, especially access to clean water. In the last 200 years, there have been 7 cholera pandemics, occurring in geographically diverse areas from Kolkata, India, to Paris, France, to Tokyo, Japan, to Mecca, Saudi Arabia, and even killed U.S. President James Polk. That wraps up these 2 topics and Unit 8. Thanks for watching. Take care.